So today I'm going to be talking to you all about desomorphine, also known by its street name Krokodil. Here's a bit of history on desomorphine. In 1932, it was synthesized for the first time by Lyndon Frederick Small. He went on to patent the morphine derivative in 1934. The drug was branded Permanid and was used as an alternative to morphine to treat pain in Switzerland and Russia, and it was an extremely effective analgesic that was used. However, it was found to be more potent and had a higher abuse potential than the drugs that it was replacing, so medical use stopped in 1952. 1 milligram of desomorphine caused roughly the same amount of pain relief as 10 milligrams of morphine, thus 10 times the potency to put it in perspective. The drug was ultimately made Schedule 1 in the United States because it had a high potential for abuse and had no accepted medical use. It was also listed as a controlled substance in the International Single Convention on Narcotic Drugs of 1961 and essentially was made illegal everywhere. Historically, desomorphine has been used as an analgesic to treat pain and in the medical field, but this was discontinued due to its high abuse potential. It became used recreationally in Russia and Ukraine, where approximately 100,000 people and 20,000 people use the drug respectively each year. Instances of desomorphine use in the United States are extremely rare. It is estimated that 30,000 people die from the drug annually. However, this drug is extremely dangerous, and the only reason that the death toll is so low is because not a lot of people use it. Now you might be thinking, well, why is desomorphine so popular in Russia, and how come I've never heard of it? Well, in 2003, Russia began to heavily crack down on heroin use, which made the drug difficult to obtain. This left heroin addicts looking for alternative ways to get high, and so they essentially resorted to making desomorphine in clandestine labs, which became popular because desomorphine was much more potent and much less expensive than heroin. In addition, all the ingredients needed to make desomorphine were available over the counter. In Russia, codeine was available over the counter, but Russia later responded by making it only available for prescription, which made it a little bit harder to obtain, but was still accessible for people that needed to get it. And it was essentially, desomorphine was essentially a inexpensive and highly addictive heroin alternative. Here's a nice breakdown showing why heroin or opioid addicts might seek out desomorphine, also known as Krokodil. It has a shorter time of high, which leads to a higher abuse potential. It takes 1 hour to cook Krokodil as opposed to weeks for heroin. Withdrawal symptoms can last up to a month as opposed to a week for heroin. Krokodil is also 10 times cheaper and 10 times more potent than heroin, and is also much more efficacious than heroin. Now let's talk about how desomorphine gets synthesized. For medical purposes, this was done by reacting codeine with thionyl chloride to form alpha chlorochloride. Through a catalytic reaction, this was converted into desocodine. Finally, desocodine was reduced via demethylation to form desomorphine. This compound must be synthesized, and it is not naturally found in the opium poppy. It is important to note the distinction that desomorphine is the pure opioid analog that is used to treat pain. However, Krokodil is the homemade version of the drug containing more than just desomorphine. It is a mixture of readily available ingredients, including sodium hydroxide, hydrochloric acid, iodine, found in disinfectants, red phosphorus, which is found in matchboxes, and codeine, which would be extracted from tablets used basically by mixing it with gasoline. The combination of these ingredients created a light brown liquid that was filtered through essentially a coffee filter to remove the solid particles, and then this liquid would be injected intravenously. Krokodil was made in underground labs and regularly contained toxic byproducts. In Moscow, they did an analysis of Krokodil samples that were found in the street and essentially found many other chemicals in the samples as well as desomorphine. The desomorphine can be taken orally, but it is typically injected intravenously, which allows for a quick onset of the effect for the drug and promotes abuse. The primary effects of desomorphine are similar to that of other opiates. These effects include euphoria, sedation, where it is 15 times stronger than morphine, analgesia, where it is 8 to 10 times stronger than morphine, constipation, nausea, vomiting, and respiratory depression. Compared to morphine, desomorphine has a shorter effect time, leads to less tolerance, and has faster withdrawal and abstinence symptoms. Desomorphine also has a much higher abuse potential than morphine, and since desomorphine is so potent and has such high efficacy, its effects will be much more extreme than those of other opioids. Also, in high doses, desomorphine can cause respiratory depression and death. Desomorphine primarily binds to mu-opioid receptors, which are inhibitory G-protein coupled receptors, and it binds as a full agonist, which means that it binds and maximally activates the receptor. Binding to this receptor promotes effects like constipation, respiratory depression, and rewarding and analgesic effects. Activation of these receptors causes an inhibition of GABA release, which disinhibits dopaminergic neurons, which promotes dopamine release, and this is primarily in the VTA and STN. There's also some binding of desomorphine with kappa and delta opioid receptors. And as seen in the figure, mu-opioid receptors are located throughout the body, such as in the brain, spinal cord, and gastrointestinal tract, which explains the wide range of effects. It is important to note that these effects are of just desomorphine. Krokodil has been portrayed in the media as a flesh-eating zombie drug, and has much more side effects due to its toxic nature. So these are the effects from Krokodil. Due to impurities and ingredients of homemade desomorphine, injection of the drug leads to damage and infection of skin, blood vessels, muscles, and even bone, especially jawbone. Iodine can cause thyroid and muscle damage. Phosphorus can cause cartilage damage. Infections in damaged tissue is common, which could lead to abscesses, vein damage, limb rotting, and gangrene, which is skin necrosis, basically caused by insufficient blood supply. Injection of the drug intravenously can lead to bloodstream infections, severe damage to heart valves, and death. Krokodil has a shorter time of action than morphine and heroin, so injection in users is much more frequent and increases the risk of infection even more. These terrible added effects are usually caused by its toxic ingredients, but the exact mechanism of these effects is not known. Also, as you can see in the side picture, these symptoms are what gave the drug its name, Krokodil, which is basically due to the rotting sores that form on the person's body that resemble crocodile scales, and Krokodil is basically Russian for crocodile. Going back to desomorphine, it makes sense that desomorphine causes these effects to the degree it does because of its chemical structure. It's very similar to other opioids most closely related to morphine, where the only difference is the elimination of the 6-hydroxyl group indicated by the blue arrows and the reduction of the 7-8 double bond in the red arrows. The structural differences produce a more rapid onset of effects and shorter duration of action than morphine. The higher analgesic action than morphine, and even than that of heroin, was attributed to the lack of the 6-hydroxyl group in desomorphine being replaced by a hydrogen. And desomorphine is also more lipophilic than morphine, promoting its penetration into the brain, which may explain the higher analgesic effect, potency, and faster overall effect. As for the withdrawal symptoms for desomorphine, it has similar effects as other opioids we saw in class. Withdrawal symptoms are essentially the opposite effects that are caused by the drug itself. Symptoms include dysphoria, hyperalgesia, which is increased sensitivity to pain, diarrhea, runny nose, and anxiety. Since desomorphine is more potent, more efficacious, and has a shorter time of action, these withdrawal symptoms will occur quicker, last longer, and be more severe than in other opioids. And as I mentioned before, Krokodil is very dangerous due to many contributing factors. It is extremely inexpensive. The ingredients are readily available pretty much, especially in Russia, and it is relatively quick and easy to make, and it has a fast acting effect with high potency and efficacy. Krokodil has a high potential for abuse, and the drug is extremely addictive, and regular users typically die within 1 to 2 years, either from overdose or rampant infections. And thank you all for listening.